welcome to the deep dive. Today, we're looking at a really big challenge in medicine right now. It's where aging meets cancer care. And it's not just a small thing, it's a huge demographic shift.
Yeah, the numbers are pretty staggering.
Right. They're projecting that by 2040, something like 70% of all cancer patients will be over 65.
Nearly 70%, yeah. That's a massive change.
So the big question isn't just, can we treat the cancer? It's how do we do it while really focusing on quality of life?
Exactly. Preserving that is key.
And that's what this deep dive is about.
Yeah.
We're looking at this group, kind of unsung heroes.
Yeah.
Really geriatric oncology, advanced nurse practitioners.
Visionaries, really.
Yeah. For 20 years, they've been quietly but fundamentally changing things. Right for the patient's bedside all the way up to, national policy.
And what's amazing is how they've basically built this whole specialty. We're focusing on three pioneers: Sincere McMillan, Heidi Ulico, and Soo-Jung Kim. And our sources, they don't just talk about one project. They describe it as this whole meticulously built ecosystem, care, education, innovation, all linked together.
An ecosystem, I like that.
They didn't just tweak things. They really redefined compassionate cancer care for older adults.
Okay, so let's dig into that. Where should we start? Maybe with direct patient care.
Yeah.
That seems like where you'd feel the impact first.
Yeah, that makes sense. Let's talk about their inpatient geriatric co-management program.
Co-management. So they're working with the surgeons?
Right alongside them, co-managing these really complex older patients just after they've had major cancer surgery.
Okay, that sounds different. What makes it special? And, what are the results like?
Well, the results are, honestly, kind of jaw-dropping. There was a study published in 2020 that showed when these ANPs were involved, there was a 57% lower risk of dying within 90 days for these patients.
Wait, 57%?
57, yeah. I mean, think about that. Usually in medicine, you get excited about a 5 or 10% improvement.
Right. That's huge.
It's a whole different level, a paradigm shift, really.
So how do they achieve that?
It's because they're managing the whole person. They're not just focused on the surgical site. They're proactively preventing things like delirium.
Which is a huge problem for older patients in hospitals.
Huge. And they're carefully managing those super long, complicated medication lists, making sure nutrition is right, getting patients moving safely. Basically, they stop those complications that can just completely knock a patient's recovery off track after a big operation.
Wow. Okay, so it's like this incredible safety net during that really vulnerable post-op period.
Exactly.
And this proactive idea, it sounds like it goes beyond the hospital stay, too. I was reading about their outpatient work, these comprehensive geriatric assessments.
Absolutely. That's a really key part of it, especially before someone goes into a really tough treatment.
Like stem cell transplant.
Yeah.
Or CAR-T.
Precisely. Treatments like CAR-T therapy, I mean, they're cutting edge, amazing, but they demand so much from a patient, physically and mentally. Right. So people like Soo-Jung Kim, they lead these really in-depth assessments before treatment starts. They use specific tools like the electronic rapid fitness assessment, the ERFA.
ERFA. Okay.
Someone described it as the most important pre-flight check for a patient's life.
A pre-flight check. That's a great analogy. What does it actually check?
Everything, pretty much. Physical function, cognitive state, social support, like who do they have at home, nutritional status, the whole picture.
And getting that whole picture,
yeah,
that's what helps with those really tough conversations about goals of care. Making sure the treatment fits the person, not just the disease.
Exactly right. It's not just about tweaking dosages. It's fundamental. It pushes back against this old way of thinking where you either overtreat aggressively,
right,
or you just write off older patients because of their age. This makes sure the plan fits their reality, their capabilities, their wishes.
It avoids both extremes. Giving treatment that's too harsh for someone frail, but also not denying good treatment to someone older but strong.
Precisely. It stops the overtreatment of frail patients who might just suffer more from the side effects, and it stops the undertreatment of robust older adults who can absolutely benefit but get judged just by their birth year. It really drives home that age is just one factor. Frailty, fitness, that's the clinical reality you need to tailor care to.
Okay, so they're clearly amazing clinicians, but, delivering great care is one thing. How do you make sure that knowledge, that expertise, doesn't just stay with a few people?
Right. That's the next crucial piece.
It sounds like this team really thought about sustainability, building for the future, and education was key.
Totally. This is where you see the real legacy building work. Sincere McMillan and her team, they created the first and still the only accredited Geriatric Oncology Advanced Practice Provider Fellowship in the whole U.S.
The only one. Wow.
Yeah, it's huge. New fields often struggle, to get established, to get a steady stream of trained experts.
Right, you need a formal training pathway.
Exactly. And this fellowship provides that. It's a formal structure for training highly specialized clinicians, usually nurse practitioners, physician assistants, to become leaders in this really complex area and make sure the expertise keeps growing.
That's incredible, building the pipeline. And it seems like they also cast a wider net with conferences and things, training more people.
Oh, yeah, like an army, as you said. So Jung Kim, for over 10 years, she's led this Geriatric Oncology Nursing Conference.
Okay.
Twice a year, hundreds of frontline MSK nurses get trained in key geriatric skills. And nurses are crucial, right? They're often the first ones to spot problems.
Definitely. They see the subtle changes.
And then there's Sincere McMillan's virtual APP symposium that drew over 180 people from all over the world.
Oh, global reach.
Yeah, it really positioned their institution as like a world leader in this knowledge.
And didn't their influence start even earlier? I saw something about working with NP students from places like Yale, Columbia. And they won a change agent award.
That's right.
What does that really mean, being a change agent in a big hospital system? That sounds tough.
It is tough. It means you've successfully gone against a grain, challenged how things are normally done in a big established place.
Right, bureaucracy and all that.
Exactly. It means you've built something so innovative and strong that it's recognized for actually changing how the next generation of healthcare providers gets trained. It's not just about having a good idea, it's about the grit, the tenacity to make it happen.
Okay, so they're training the next generation, which is vital. But how do you weave this geriatric know-how into the daily fabric of a huge hospital? Make it part of the culture?
Yeah, how do you make it stick everywhere? That's where their grassroots stuff is brilliant.
Like the Geriatric Resource Nurse Program, the GRN.
Exactly. That was initially set up by Heidi Ulico. It trains nurses on different units, inpatient, outpatient, to be the local go-to expert on geriatrics.
So like champions on each floor.
Kind of like sentinels. They're trained to use tools like the CAM, the confusion assessment method. It helps nurses quickly spot even subtle signs of delirium.
Which we said is so important to catch early.
Critically important. Catching it early can mean the difference between a quick recovery and, a much longer, more complicated hospital stay. It's like a grassroots movement changing care right at the bedside.
That makes so much sense. And that same kind of practical systems thinking seems to apply to falls prevention too. A fall for an older cancer patient could be disastrous.
Absolutely catastrophic. It can totally derail their cancer treatment. So Jung Kim's leadership here is key again. She co-leads the hospital-wide falls steering committee.
The whole hospital?
Yeah. She helps run a specialized clinic just for falls and develops patient education materials they use across all their sites now.
Wow.
It's practical, it's visible, and it genuinely saves lives. It's seeped into the whole institution.
And they've even taken this into the digital world, health informatics. That seems like another level entirely.
Yeah, they're not just clicking boxes in the electronic health record, they're helping build it. They're epic super users.
Okay.
They create tools like a dashboard that shows falls in real time. But even bigger, Sincere McMillan was nominated for the National Epic Geriatric Steering Committee.
National. So for the software itself?
Yeah. That means her expertise is helping shape the software design that millions of doctors and nurses use across the country.
Whoa.
So she's influencing care for patients who might never even come to their hospital. That's incredible reach.
That really is profound. And, okay, finally, there's maybe the deepest level of their work, tackling ageism.
Yeah. This is maybe the toughest barrier.
That bias, sometimes it's not even conscious, right?
Okay.
But it's there.
It's pervasive. So the team worked together to create a national online course specifically about ageism in cancer care.
An educational module for other professionals?
Exactly. They're directly fighting that implicit bias that can mean older adults just don't get offered potentially life-saving treatments purely because of their birth date.
Not based on their actual health or ability to handle the treatment.
Right. They're pushing for this culture shift, so every patient is seen as an individual. Their fitness, their resilience, who they are, not just a number.
It's about seeing the person, not the age.
That's the core of it. And when you step back and look at everything they've done, I mean, from saving one person's life after surgery to training people all over the world, from changing a hospital handout to advising on national software, it's just It's remarkable.
It really is.
It really gives you a blueprint for how you build a whole medical specialty,
Right.
from the ground up. And doing it with compassion right at the center alongside the science. The work these three women, Sincere McMillan, Heidi Ulico, Soo Jung Kim, have done, it's defining what cancer care should look like in the future, making sure that all our fancy technology is matched by wisdom and compassion and how we actually care for people.
A truly inspiring story. You can really see the ripple effect of their dedication.
So something for you, our listeners, to think about here. How does this focus on whole person care and really fighting ageism in cancer treatment? How does that resonate with your own ideas about personalized medicine? And maybe what could this kind of holistic approach mean for other parts of healthcare, even outside of cancer?